Hi, everyone. My name is Angela Antilla, and I am a subject matter expert with the CDC NHSN in the long term care facility component. I see a lot of very familiar faces here today, and just wanted to say welcome to Atlanta, Georgia, and to the CDC campus. I am happy to see the faces that I recognize, and I'm happy to see the new faces in the room. And I hope that you guys have a very enjoyable week. And I'm also very excited to see that you're working on your icebreaker. I want to know, has anyone found the person with colorful socks yet? Okay. We were a little concerned that may be a challenge, but okay, well, good. So don't forget, you have today and tomorrow to get these complete, and then if you'll just fold it, be sure to put your name on them and fold them up, and we'll have a basket at the front table for you to put them in, and we're going to do some little drawings on Thursday before you guys head out, just for some small giveaways. But okay, so I'm going to spend the next 45 minutes giving you a high level overview of the NHSN application. After I finish my session, Ramon will come up and fingers crossed that the internet works for us. He will give you a live demonstration of the NHSN application. And then we'll have another presentation about CDI and MDRO surveillance, and then we'll let you guys break for lunch. We are going to attempt to do poll everywhere during my sessions today. I believe I'm the only speaker this week who will be doing poll everywhere. But if you want to participate, there are instructions on everyone's table. You will text message, participate by texting the message NHSN to 22333. And once you do that, you should automatically be joined. You can also join online. And here is the web address. For those of you participating via web streaming, we would also like you to join the poll everywhere as well. So if you want to go ahead and get that open on your phones or your computers, once you log in, I believe the application will keep you logged in for the duration of the day. So you should only have to log in once. Okay, so for this session, our learning objectives are we're going to define the National Healthcare Safety Network, or NHSN, which I believe that we've had a great foundation so far. So you probably already you've already met learning objective 1, I'm sure. Number 2, we're going to describe how NHSN supports long-term care facilities, infection surveillance activities. And then we're going to describe how NHSN we have a duplication. Then again, we're going to describe how NHSN supports your infection surveillance activity. So you see how important that is? So Dr. Pollock already shared this slide just to give you an idea of how much NHSN has grown since 2005. You can see we have 6 different components within NHSN, and we have the neonatal component on its way in 2020. For you guys specific to long-term care, the 2 components that you are going to be most interested in are likely the healthcare personnel safety component, which will allow you to track and report your healthcare worker influenza vaccination. And that team has a table set up out front. If you haven't already visited them, I noticed they have some pamphlets and some nice information at their table. So if you have a chance and have not already done so, please go take a look at their table, and they're free to answer any questions you have. And then we have the long-term care facility component, which is what we're really focusing on today. With NHSN, there are reporting options available to long-term care facilities, and you're going to hear about this all week. So I'm going to quickly go through this list. But what we provide are standardized surveillance definitions and data collection. And what that means is that while you're participating in NHSN, you will use a set defined definitions and criteria that will allow you to over time compare apples to apples internally, and as well as facilities who use NHSN outside of your facility. Rest assured, the data that you report to NHSN are secure and kept confidential. as well as it's immediately available for you to do internal analysis. So let's say that you enter your data at 9 o'clock in the morning and your DON calls you to an emergency meeting for a potential MRSA outbreak at 11. You can immediately go into the application, and any data that you have put in up to that point is automatically retrievable to you. So that's a good thing. A lot of facilities use the NHSN data for internal data quality, data improvement. So when prevention processes are implemented, you're able to look at your data before and after. So we'll talk a little bit more about that as we go on this week. The CDC uses the data to establish risk-adjusted metrics, and that is something that we are working on the long-term care facility component. As more long-term care facilities come on board, we're able to get the data and look at the facility characteristics of those individual nursing homes and skilled nursing facilities that are reporting the data. And that allows us to risk adjust based on risk factors or other factors that are specific to certain facilities, such as facilities bed size and standing and so forth. And then, of course, the data may be used by our health department and other partners in prevention process and performance management. So I talked about the two components that are available for long-term care facilities. Again, the long-term care facility component, which allows resident infection and process measures surveillance, and then the healthcare personnel safety, which is influenza vaccination. Long-term care facilities eligible to enroll in NHSN include your certified skilled nursing facilities and nursing homes, your intermediate chronic care facilities for the developmentally disabled, and assisted living facilities and residential care facilities have limited options, specifically around the prevention process measures. Dr. Bell talked a little bit about the three modules that are available for long-term care facilities. So we have the healthcare associated infection module, which allows users to perform surveillance and reporting for urinary tract infections, and that includes both catheter associated and non-catheter associated UTIs. And then we are working on the respiratory tract infection or RTI module now, which is going to be released soon. I don't mean like this year, but hopefully next year. And then once that is released, we will be working to release the skin and soft tissue infection module. So just want you to know that, as Dr. Bell talked about, we are continuously putting efforts in to grow NHSN and to grow our options for reporting. And this is based on things such as your feedback to us when you tell us what is important, what infections are most prevalent in your facilities, and what you're most interested in doing analysis on, as well as things like Nicola was talking about, the prevalence survey, the data that's coming out of that survey of what infections are more prevalent and where do we really need to focus our surveillance efforts. And then we have the laboratory identified event module or lab ID event module, which uses basic laboratory metrics and admission data to provide a proxy measure of infection. And this module is available for C. difficile infections, as well as several of the multi-drug resistant organism infections. And then we have our prevention process measures module, which allows users to perform surveillance and analysis on adherence to gown and glove use and or adherence to hand hygiene practices. During this week, you're going to get an in-depth look at each of these three modules. Wanted just to provide you an example of what our home page looks like. This is your go-to page. If you do not already have this URL hyperlinked, I highly recommend that you hyperlink the URL and have this as an easy click of the button so that you can get to this page. You'll have access to the protocols, to frequently asked questions that come in with our responses, trainings, any validation, archived newsletters and email communications that we send to our users, as well as the overall long-term care facility component manual that we provide on an annual basis. Speaking of the manual, I just want to point out again, you guys have the manual. That is the binder that you received. We provide that manual each calendar year after the new protocols come out. So I would say February to April, sometime in that time frame, this new manual gets posted to the website. And what this allows you to do is just save one time as a PDF onto your desktop or onto your phones, or if you want to print the manual. And it saves you time. It's more efficient because the manual combines the protocols and the forms and the instructions and everything that you need to perform your surveillance, so that you're not pointing and clicking in various places on the website. NHSN provides forms and instructions for all of the surveillance options that you may be interested in. These forms are optional. You do not have to use our forms, but they do provide an efficient way for you to collect your data. If you need to collect data on the floors and maybe you don't have a laptop or a way to electronically capture that, you can easily print these forms and take them with you to the nursing stations and fill in the data as you do your rounds. We have denominator collection forms that some of our nursing homes will actually leave at the nurse's station and have the help of the nursing staff to complete these denominator forms. The forms are also customizable. So let's say that you like our form, but your facility wants to collect a little bit more than what we have available. You can customize the forms and add additional data collection options. Each form has a table of instructions, and the table of instructions will give you details of what the question is asking. And this is important, especially when you're reporting information into NHSN, because you want to make sure that you're reporting the most accurate data into NHSN. Because remember, garbage in is garbage out. I had to say that, Janita. And by using these forms, that's the best way to know that you're capturing everything that's going to be required when you go sit down in front of the computer to electronically enter that data. The last thing you want to do is sit down in front of the computer, log into NHSN, and realize, I forgot to write down that specimen collection date, and have to go back to the floor, collect additional information. So by having the forms, you know exactly what information you're going to need to report into NHSN. So next I want to talk about the steps to participation. And I like to break this down kind of in order of how I see steps of NHSN participation and what makes it easy as an adult learner to understand, because there are a lot of moving parts and it can get confusing, especially if you're brand new. Speaking of, how many people in the room are brand new to NHSN? So we have quite a bit. So I'm hoping that this helps you. So the first thing you want to do, of course, is you want to enroll. If you are a new facility, you want to enroll that facility. If you are already enrolled, or if the facility is already enrolled, then you do not enroll again. You only enroll a facility once. And this means even if your NHSN facility administrator leaves and you get a new person, the facility is already enrolled, right? So that facility does not need to be enrolled again. You just need to add an additional user. So let's go through this checklist. We have a 5-step enrollment for long-term care facilities. How many of you have seen this on our website? Okay, good. If you go to this website, you're going to see the steps to enrolling, and it's 5 steps. And I almost said 5 easy steps, but I stopped myself because they're not easy. I didn't want you to throw anything at me. But here's our website. I listed it at the bottom here. There is an enrollment training guide, and I highly recommend, if you're new and you haven't yet enrolled, I highly recommend that you access this training guide, because it will give you detailed information on enrolling, including pictures. I love pictures with instructions. So many of the instructions in this training guide are picture instructions, which makes it much easier. So get this training guide, print it out, save it to your computer, and use it as your best friend for enrollment. Once you complete enrollment and you get that nice, pretty Sam's Grid card, then you're ready. You're ready to log into NHSN and start reporting, okay? So this is what you're going to see when you log in. So before you get your SAMS grid card, this is going to be what you may use. But once you get that SAMS grid card, you're logging in here under the SAMS grid card. If you try to log in here, it's going to frustrate you because that is not the right place. How many of you have logged in over and over on this side? Do we have people in here that have done that and they call us and what have I done wrong? Well, it's just not the right place. So here's the right place to log in using your grid card. And then you're going to come to this screen. So what should you push on this screen? Reporting. So there's no need to enroll, right? Because you've already enrolled. So you go directly to NHSN reporting. And then you're going to come to a page. Your page may look a little bit different from this screenshot because our access is a little bit different from yours, but you're going to select your facility, and if you're only one facility, then that will be the only facility that will populate. But let's say that you're the facility administrator or you're a user to multiple facilities, which is definitely possible, then the drop down will include all of the facilities in which you have access to, which is a wonderful feature. And then you're going to click Submit at the bottom. Then you're going to come to this page, and this is your NHSN homepage. And this side, I like to say, as my navigation bar. Everything that you want to do can be done through the navigation bar. In the middle, you don't really want to see the middle populated because what that means is you have outstanding things that need to happen. It means that you have work to do. So here, action items are going to be alerts, and I'm going to talk about the alerts, but alerts are things that you need to take care of before your data are considered complete. Coming in July, sometime in July this month, above that, you're going to see a dashboard, and Josephine is going to talk more about this, but this is going to be your infection dashboard where you're going to have access to tables and graphs with your infection data. It is super great, and I cannot wait until you guys see that. But I can't show it to you because I do not want to steal Josephine's thunder. Okay. So you've logged in. You're aware of your homepage. The first thing you want to do as a new facility is map your resident locations, okay? Before you do anything, you've got to map those locations. And what that means is you have to assign every resident location, as far as a nursing unit, a pod, whatever you call them in your facility, you have to assign that to a CDC location label, okay? In your binders at the end of tab 2, so the very back of tab 2, you will see these locations and the descriptions because I know you probably can't read this up here, but those are the CDC locations and descriptions that you will map your resident care locations to. So the first thing you want to do once you gain access to NHSN is just set up those locations, okay? We have instructions on the website, as well as I'm going to actually go through some instructions here for you. So to map your locations or set up your locations, you go back to this home page and you see on your navigation, you're going to click Facility. And when you click Facility, this is going to open and you're going to click Locations. Once you do that, you're going to see this here. And that's what you're going to populate or add to. Now, let's say you are a new NHSN user, right? Or excuse me, a new NHSN user in a new facility. So let's say this is your first week on the job and it is an NHSN facility and you're just curious about the locations that they previously have mapped in NHSN. What you can do is go to this page and instead of entering information, you go to the bottom and you click Find. And when you click Find, it will populate all of the locations that are already set up for that facility. So it will show you what the previous IP has set up for the facility, and that'll allow you to determine, do I need to edit these locations or are they okay? Or deactivate? So to add, you're going to put in, let me see, I think I have a screenshot for this. Okay. I apologize, my screen went black up here, so I'm having to turn around. But so you're going to add your code and your label. So if you call pod one, then you may want to put your code as pod one. And then your label, let's say that pod one is your dementia unit. You could put in your label as dementia unit. You want to fill in the blank so that when you look at the location, or anyone in your facility has to do data collection or entry for you, when they look at that location code and label, they know exactly where that is in the facility. Does that make sense? And then the CDC location and description, that is what you're going to map it to. So that is the page I just pointed you to. You're going to figure out which CDC location code does that correlate with, and you're going to select that from the drop-down box here. Actually, I have a screenshot for that. So you'll see that when you open the box, all of the CDC location codes labels are going to be listed for you. So you just make your selection. The status is going to automatically say active, so you can leave that. And then bed size. You want to put in how many beds are in that unit. And once you've entered all of that information, you're going to click add. And what you're going to see is that location will now be added at the bottom. One important note to make is that users are not able to delete a location. This is very important. So make sure all of your information is correct here before you click add. Once you add, you cannot delete. Not to say that you can't deactivate, you can. So let's say that I meant to put 129 beds and I only put 29 and I saved. Well, what I would have to do in order to correct this is I would have to put a check mark in that box to deactivate. Even though my screenshot says delete, it really means deactivate. It's just the wrong button, wrong wording. It would deactivate, and then I'd have to re-enter that location. Okay, does that make sense? So, and we do that because if we delete a location, then it will delete all of the information or events associated with that location, and you don't want to do that, even though it wouldn't be applicable to a new location. But let's say that you've had this 1S has been the location for the past 5 years, and you close the unit. You don't want to simply delete the location because there's data associated with that location. So all of the data with the deactivated location will still be available in NHSN for you because you just deactivated it. And I talked about the find already, but when you click find instead of adding information, this is what you'll see. And you'll just, as a new user in a facility, you do want to just check to make sure that the ones that should be active are active, and the ones that should not be, you can deactivate. The next thing that you want to do as a new user or new facility is add additional users. This is not required by any means, and this is actually one of the tasks that really can be done in any order. It doesn't have to be done in this particular order, but we highly recommend that all facilities have at least 2 NHSN users, if not 3. Because if one person leaves the facility, you want to have at least one person there with access, right? It becomes pretty challenging when the only NHSN user leaves the facility. It actually causes chaos for the administrator. So we highly recommend that you have multiple users that are able to enter data and add new users and do other functions within the application. When a new user is added to a facility, so let's say that you're a new IP and you're going to general nursing home, and it is already an NHSN facility, so you do not have to enroll the facility. But what happens if you are not an NHSN user and you don't have the grid card? What needs to happen? Anybody want to guess? I think I heard it. Someone in that facility must add you as a new user to that facility. So see why it's so important to have backup users in each facility, because if the only person with a grid card left the facility, who's going to add you as the new IP to that facility? It can be done, but you have to go through NHSN to do that. So you go in, you're a new user, you have someone in the facility who's already an NHSN user add you as a new user. And then what happens is you're going to receive an invite from NHSN to participate. And so you want to make sure you check your email and go through that 5-step enrollment process, even though you're not enrolling a facility, because you need to set up your computer. A lot of facilities block emails from CDC. You do not want to hear from us. We go straight to your junk box. So it's really important that you set up your inbox so that you can receive emails from CDC. Otherwise, you will not receive enrollment-related emails. To add a new user in your facility, you go back to your navigation. You're going to click Users. You have the option you can add or you can find. So if you're just curious how many users are in the facility, you click Find, and it'll show you everyone who's listed as an NHSN user in your facility. But to add, you click Add. This screen's going to populate. You're going to give the person a user ID. We recommend it can be anything you want, but easy is their first initial and last name. But again, it can be anything that you want, up to 32 letters and numbers. Everything in the red asterisk must be completed. You don't have to complete all these boxes. Basically, their first name and their last name and their phone number and email address. That's what we need to know. The email address is critical because that is going to be the address in which that person receives all communication from NHSN and enrollment communication, as well as that will become their SAMS ID number, okay, ID code. So really important that that email address is correct. Then you will be asked to assign rights, NHSN rights. You can assign administrator rights to the person, and that gives that person all rights in the facility to analyze data, add, edit, delete data, view data, add new users, deactivate users. Or if you want to just give very specific rights. So let's say that you have a student volunteering for you and you simply just want her or him to enter data. Then you could give just rights to add, edit, delete data. Or if you want to allow your medical director to see the data in NHSN, but you're really scared that he may accidentally delete something, then just give him rights to view the data. So you can see, I mean, there's several options here for when you're adding a new person. So next I want to talk about the annual facility survey. When you initially enroll into NHSN, as part of the enrollment process, you will complete that NHSN annual facility survey. If your facility was active in the previous calendar year, okay? If you are already enrolled and the year's January is coming back around, then you have to complete it for your current facility. So it happens when you initially enroll and then yearly thereafter. The annual survey opens up in January, and in March 1st is the deadline. And what that means is that if you have not completed your annual survey by March 1st, then you lose access to entering data into NHSN until you complete it. It doesn't mean you're going to lose access to NHSN or that we're going to delete all your stuff and tell you goodbye. It just means you're not going to be able to do anything in the application until you get that survey complete. The surveys are based on facility characteristics and practices in the previous calendar year. Okay, so for this year, for 2019, when you completed that survey, you were answering questions based on the facility practices in 2018. There are one or two questions that say on this day, but other than that, the rest of the survey is based on the previous calendar year. We have a form for the survey. If you are new to completing this survey or if you're getting ready to enroll, I strongly encourage you to go ahead and print out this form so that you know what's going to be asked of you when you sit down at the computer to enter your data, because the survey will not allow a user to save it incomplete, meaning you could get through question 25, and if you don't know the answer to question 25, guess what? You're going to lose your answers to questions 1 through 24. So it's important. So go ahead and print out that form and those instructions so that you can make sure that you know the information before you sit down in front of the computer. Accuracy is extremely important. We use the information on these surveys to build risk adjustment models. And what that means is we're looking at what is the risk of a resident getting an infection in your facility based on, as opposed to a resident getting an infection in another facility. So it's really important that you answer these questions as honestly and accurately as possible. We do not look at individual facility level questions and answers. We're looking at aggregate level, so you will not be pointed out. Just to show you how to do your survey, if you have not, okay, first let me ask, when you log in, does anyone see this right now? Good answer. So if you still see this, that means you are delayed, meaning you missed your deadline and you need to do your survey. So hopefully you will not see this right now. You will see this in 2019 when the survey becomes available. So or 2020. So in January, you're going to see a complete this item and it'll say, 2019. So you can click here. The other place is on your navigation bar, go to survey and add. And that's where you'll go to add your new survey. So then you'll select your survey year and find or add. One thing I do want to say is that you're able to review your surveys from previous years. So let's say that you completed an annual facility survey last year and not much has changed in your facility. So you want to print that survey and use the same answers, right? It makes sense. So you can do that. So by going to the survey and just do find, and then find the survey that you want to, that you've already completed. And then you're able to open that survey and all of your responses are there. So it's very easy. If you find that you need to edit a survey, so let's say this week you learned something new and you realize, oops, I don't think I understood that when I did my survey for 2019. You can go back and edit your survey as well. But just remember, the responses are based on the previous calendar year, not this year. Next, I want to talk a little bit about the monthly reporting plan. So the monthly reporting plan is required for each facility to submit data into NHSN. So basically that monthly reporting plan informs us on what your intentions are for a given month. What is your plan for submitting data? So it requires a little bit of planning ahead on your part to kind of determine what infections or prevention process measures is my facility going to look at for the next 6 months. We recommend that you at least be consistent for 6 months, but if you can be consistent for a year, that's even better. But so look at your risk assessment and base your plan off your risk assessment. What is important to our facility? What infections do we need to really take a deep dive into? And then that will inform how you set up this monthly reporting plan. A facility must have a monthly reporting plan on file before you submit any event or denominator data into NHSN. You have to have that reporting plan. If you already know what the plan is for your facility for the entire year, then you are able to complete your plans for up to 1 year in advance. That option is available. And then you also have the option to view, edit, and remove surveillance options. So let's say for the month of February, you were really excited and you thought you were going to look at all of the MDROs and C. diff and UTIs, and then you had a staff member quit on February 1st. And you realized we didn't have a chance to look at half of what we said we were going to look at in the plan, you can go back and edit the plan and remove options retrospectively, as long as you haven't already entered data. Okay, once you've entered data related to those events, you can't remove it from the plan unless you also remove that data. But if you haven't entered any data, then you can certainly update your plan. To enter a plan, go to your navigation, click reporting plan, and then add. And you see you also have the option to find if you wanted to look at previous plans. Just to review here, there are 3 surveillance modules that we've talked about. So the HAI for urinary tract infection, and then you've got the lab ID for your C. difficile and your multi-drug resistant organisms, and then you have the prevention process measures for hand hygiene and gown and glove use adherence. So each of these are kind of sectioned off in the monthly reporting plan. So you see the first one is the HAI module. As we add new modules such as the respiratory tract infection, that is going to fall under the HAI module. And then the next bucket or section here is the lab ID event module. And then the third is prevention process. And this is just a screenshot of how you're able to edit. So if you click find your plan, this is a plan that we've already submitted. You click edit and it'll allow you to add additional modules or make additional edits as necessary. And just remember to save your edits. One pointer. This doesn't happen often, but you may just want to make a little note of this. If you entered your plan for 12 months and there is a month where you performed 0 surveillance, you cannot, NHSN will not allow you to delete a plan. So let's say for February, you just were not able to enter any data. You were not able to do any surveillance, but you already had a plan in place. What you have to do is go to that month in your plan, and at the top, you see up here where it says, no long-term care facility components followed this month. So do edit and then put a check mark in that box, and that will update the plan so that we know that you did not have any intentions of entering data for that month. If you don't do that and you don't enter data, your homepage is going to blow up with alerts saying, oh, you need to do this, you need to do that, and your data will not be considered complete. And if your data aren't complete, guess what? Your dashboard is not going to look good because you're going to have incomplete data. And so that month, that quarter will be excluded from your dashboard. It's very important that you do this if there's a month where you did not conduct any surveillance, but you already had a plan in place. If you didn't have a plan in place, that's okay. You don't have to put a plan in place. But so this is only if you already had a plan in place and you need to edit. Does that make sense to everyone? Okay. I'm having technical challenges up here, so I don't know that you guys are going to really be able to participate in the poll everywhere. So I'm going to read the question to you, and then we'll just do a show of hands, okay? Based on this reporting plan, what modules and events will this facility report for April 2018? I'm going to give you just... So how many of you say A, UTI only? How many of you say B, UTI, lab ID for CDI and MRSA, and prevention process measures for hand hygiene and gown and glove use? Okay, and how many of you say C, all modules, all events? Okay, let me see if it'll give us the answer. Well, the answer was C. The answer was C. Excuse me, B. The answer was B. It's not C because under the lab ID event module, you can add rows, and there are additional multi-drug resistant organisms that you can add to perform surveillance. So this facility is looking at UTIs, looking at C. difficile and MRSA lab ID events, and they're looking at hand hygiene and gown and glove use prevention process measures for April 2018. So that's what yours will look like when you complete it based on your selections. So it does look like our web streamers are able to poll because we do have some responses from the web streamers.
I'm going to reset this monitor.
Okay. Good job, web streamers. So 83% of the web streamers, and I don't know, did any of you try the polling in here? Did it work for you? Okay, so that's good to know. So it appears that it's working for them. So that's good to know. Good job. 85% of you got this right. And definitely I can see C was confusing if you're not as familiar with the modules, but by Thursday at 12 o'clock, we'll have 100% on this question. So while she's doing that, you can still see my screen up here. Let's just talk next. So we've set up our monthly reporting plan, right? So the next thing is you're ready to submit your event data, right? So as you're finding events on the floors, UTIs, lab ID events, whatever you're monitoring for the month, you're able to submit that resident level event data into NHSN. So again, I know you're familiar with this, but you're able to submit the UTIs and the lab ID events. So those are the two modules where you're going to submit event level data if you choose. And we're going to, I did not put screenshots up here on how to submit the event level data because I'm going to show you that within each module this week, okay? Resources. I think this is a duplicate slide as well, but that should show you it's a very important slide. This is where you go for our resources. You can see that when you click on a specific module, once you open that module, you're going to see this pop up, and this is where the additional resources are. So you have your data collection forms, your supporting materials, FAQs. A lot of people love the FAQs. If you, as you begin reporting and you come across common questions that you have or that you're hearing others have, send it to us as a suggestion, thank you, to add to the FAQ document. We love suggestions. We update this document as we have updates to make. So send us your suggestions for the FAQ document and we'll be happy to add those. And you may read this document and see a question that you've submitted to us in the past in our FAQ document. Okay, the monthly summary data. The monthly summary data has to be submitted for every month that you have a plan in place, even if you have 0 events to report. Okay, so this is also referred to as the denominator data. So what you're going to do is at the end of the month, you're going to take the monthly total for the required denominator data for the modules that you're following, and you're going to enter that complete total into NHSN. We do not, because we have no reporting mandates federally with CMS, we don't have a specific cutoff date that says your data has to be entered by X date of the month. But for best practice, because memory recall, it's best to have all of your event and your denominator data entered before the end of the next calendar month. So let's say for February, by the end of March, it's best practice to have all of your event data entered as well as the summary data for February. Does that make sense? But again, CDC, we don't have a cutoff. If you have individual state mandates, then your state will tell you, okay, we're running data on the 15th of this month, so all of your data must be entered. But other than that, you enter the data at your discretion. If you did not report events for a calendar month, then when you're submitting your denominator data, there is a place for you to document that you reported 0 events for the month. This is And a screenshot of what the denominator data will look like. I want to point out here, I don't know if you guys can see this, but your denominator, your summary data page will populate based on the monthly reporting plan for that given month. Okay, so when you enter up here, let's say I enter January 2017, what happens in NHSN is NHSN backtracks and it looks at your monthly reporting plan for January 2017. And then it populates the summary data so that you know what has to be completed on the summary data. Because if you're not reporting C. difficile infections, do you want to complete summary data for C. difficile? No. So what happens is once you put in the year and the month and the year, your summary data page will populate based on only what you have to report. So, and that is indicated by the red asterisk. If it has a red asterisk, it means you must enter correct data. If it's grayed out, it means that you don't have to do anything with it. You can't do anything with it. So you can see this reporting plan, there's UTIs, MRSA, C. diff, and hand hygiene and gown and glove use. So on the summary data, all of those are active fields. And you're going to see more of this as we progress this week. Okay, review question number 2. Based on the below monthly summary data, what modules and events did the facility commit to participate on the monthly reporting plan for March? So this is a monthly summary data. So remember I said your monthly summary data is a direct representation of what you put in that monthly reporting plan. So looking at this, what does our monthly reporting plan say we're doing? So A is all modules, all events. B is MRSA and CDI lab ID events. And C is CDI and MDRO lab ID events. Okay. All right, so very good. 94% of you got that correct. It's MRSA and CDI lab ID events. Very good. The last thing I want to talk about is data quality and resolving your alerts. So remember I told you that you do not want to log in and see those alerts on your home screen because that means you have work to do, additional work to do. But it is important that you resolve those alerts because your data are not considered complete until those alerts are resolved. And what that means is that this person right here has a lot of work to do. And it also means until these alerts are resolved, this person is not going to have good dashboards. They're going to have pretty blank dashboards. So you want to go in and resolve the alerts, and I'm going to talk more about that this week on how to resolve the alerts. But basically, you can click into each of the numbers, and that takes you to page after page with instructions on how to resolve the alert. You'll also notice on this navigation bar, you can click alerts, and it gives you more of a similar page, but more of a list of all the alerts that you have to resolve. So here is an example of what that looks like. So you can see the alerts are divided into 4 categories. You have your missing events, and what that means is you started entering an event, a UTI event, and you saved it before completing the document. So that's a missing event. Or let's say that you put on your monthly reporting plan that you're going to follow UTIs, right? But then you didn't report any UTIs, and your summary data doesn't indicate that you didn't have any UTIs. So I know that's confusing now, so we'll talk about that more as we get into UTI and other event reporting. But you have incomplete events, missing summary, and incomplete summary data. And then lastly, trying to get us back on time here, when you are done entering data and you're ready to walk away from your computer, we just ask that you log out of NHSN. And this is important because we have thousands, I think 22,000 plus facilities using NHSN. So the bandwidth gets pretty stretched, and if you're in idle, you're still using space. And I don't know the technical jargon for that, but we just ask that you log out so that maybe it'll free up a little energy, or I don't know the technical word, for someone else. So you can log out by clicking your name in your username in the right hand corner, and then logging out here. Speaking of the right hand corner, if you ever send us an email and ask us a question, and we ask for your NHSN user ID or facility ID, you can find it here. Okay. All right, and so that concludes our overview. Do we have any questions? I can take questions now, or I'm going to be here all week if you want to catch me during a break. I'm just trying to get you guys out to lunch on time, and we have 2 more speakers. So if you have a question, come to the mic. If you don't, I'm going to pass this to Ramon, who is going to walk you through a live demo.